Hello, I am Dr. Ashish Bavdekar. I am a consultant pediatric gastroenterologist and the director of pediatrics at the KEM hospital here. I am going to talk some briefly about liver diseases in children. Liver is a multifaceted organ. It has got many functions: detoxification, it removes the toxins from the body; digestion, it helps in digesting the food that we eat; metabolism, it produces and synthesizes proteins, and is also useful for regulation of sugars. As you can imagine, when you have a liver disease, either one or all of these functions can get impaired, causing serious problems. An important point to remember is the diseases that cause liver problems in adults is completely different from diseases in children. In adults, usually alcoholism, either gallstone related disease, cancers, hepatitis C, these are the common causes. None of these are common in children. In children, we have to deal with either drug related liver problems, some infections, and more commonly genetic or metabolic liver diseases that are basically inherited problems. So it's important to differentiate these two groups from the adults as well as the children. But irrespective of what the cause is, in children, liver disease presents in two types. One is the acute type. This type is where there is a very short history. The child comes with fever, nausea, vomiting, jaundice, and that's when they reach us and we start the investigations. These are usually related to infections like hepatitis A or E. Within the last 5 to 10 years, we are finding even other infections like dengue fever, typhoid, chikungunya, all causing liver problems. Luckily, most of these problems with appropriate treatment, patients get better, liver gets better, and they quickly go home. Occasionally, one child can develop severe problems and go into hepatic coma. In contrast to this acute presentation, the next presentation is like a chronic presentation. In this, the presentation is very insidious. That is, the child will have jaundice, may or may not have fever, slowly develop swelling of the abdomen, swelling of the feet, swelling of the eyes, can have blood in the vomiting, and this goes on for a couple of weeks or months. Most children having this chronic presentation actually have a liver disease which has been going on for a very long time but has never been picked up because the child never had problems. In this group of disorders, it is very, very important that we quickly make the correct diagnosis so that we can start the correct therapy so that the child can recover before the liver is completely failed. In this group of disorders or children, what is important is trying to get the diagnosis as quickly as possible. Some of these children will require medications, some require surgery, but especially the group that has got genetic problems or metabolic problems, they will not have any medical treatment. The only way out for them is a liver transplant, which can be life-saving. And all of this needs to be planned very early. Whenever a child has a liver problem, your doctor will do the appropriate tests. These tests are usually blood tests to find out how good the liver is functioning, what is the cause of the liver disease. He will get a sonography done, which will tell if there is any other problems around the liver, like is there any water in the stomach, is there a swelling of any other organs, and occasionally a liver biopsy, that means taking a part of the liver, is necessary. Whatever it is, liver disease has to be taken seriously in children. Whether it's a small baby with jaundice or a 10-year-old child with jaundice, it is all extremely important that it is shown to the doctor and let the doctor decide how to take this forward. At the end, I would like to suggest a few tips to the parents or the people who are listening to this. Take jaundice very seriously. A lot of children with jaundice or liver disease, even if they don't have jaundice, have easy bruising or easy bleeding. Now we know children are playing around, they get hurt and they bleed. But this is all normal. But if your child is getting bleeding spots or bruises which are just coming up on their own without any history of this child having a problem, this could be a manifestation of a liver disease. So please show it to your doctor. Most of the liver disease in children cannot be prevented, but at least those that can be prevented, we should do. Towards this, taking hepatitis A vaccine, taking hepatitis B vaccine and a typhoid vaccine is absolutely essential, because whatever little diseases we can prevent, we should be able to prevent. Lastly, paracetamol, which we commonly use for fever, if given in high doses, also can cause a liver disease. At the same time, I don't want parents to get worried about it, because most pediatricians would prescribe it in the normal recommended doses, in which it is absolutely safe. It's only when it is given at 2 or 3 times the recommended doses that it can cause liver disease, and we are seeing children presenting to us with a liver disease in this particular stage. So at the end, please take jaundice and liver disease seriously and follow up regularly with your pediatrician or with a pediatric hepatologist or gastroenterologist. Thank you.